Hi guys, my name is Natalie Thurman, and for my 5-minute video, I'm going to be talking about spinal stenosis. So what is spinal stenosis? It's a narrowing of the spaces within the spine that put pressure on the nerves traveling through the spine. The pressure might cause pain that is exacerbated by walking or standing and is relieved by sitting or lying down. It occurs most often in the lumbar region of the spine and is called lumbar spinal stenosis, but it can also occur in the cervical spine. Most patients report back pain, sensory loss, weakness in the legs because of the spinal root innervation within the spinal canal, the lumbar spinal canal. Pain is the most common presenting feature, and it can be congenital or acquired. So what puts people at risk for spinal stenosis? The number one is age, over 50 years old. Also just general wear and tear, bone spurs, herniated disc, tumors, any trauma to the spine, and patients with a history of scoliosis can also be at risk for lumbar spinal stenosis. So what are the 3 key questions that are essential to ask in the workup for this diagnosis? Number one is, do you have lower back pain? 93% of patients who have LSS will present with back pain. Number 2 is your pain aggravated by walking or standing and then relieved when you sit or lie down? Neurogenic claudication is a hallmark sign of LSS. And in a systematic review, this finding was moderately sensitive and was present in 82% of patients. No pain with sitting was the most specific finding and thus the best indicator of LSS. And the last one is, are you experiencing numbness or tingling? 63% of patients will present with numbness. This is a very common sign of spinal stenosis because the nerves of the spinal cord are being compressed and causing numbness. It can also rule out other differential diagnoses like a pulled muscle or sciatic nerve pain. So what are the top 3 physical examination components? Number 1 is a decrease in lower deep tendon reflexes. If the nerve roots are compressed enough, DTRs in the lower extremities may be decreased or even absent. In a systematic review, they found that patients had 43% of patients had decreased or absent ankle DTRs, and then 18% had absent or decreased in the knee. Next is a positive Romberg test. Romberg test involves the patient placing their feet together and attempting to maintain balance with their eyes open and closed. This shows signs of lower extremity weakness, and patients with spinal stenosis can have lower extremity weakness. And the last one is bowel and bladder dysfunction. Cauda equina is a complication of spinal stenosis, and it is an emergency. If a patient presents with back pain and bowel or bladder dysfunction, they require immediate surgical consultation. There are a couple non-surgical and surgical treatments to spinal stenosis. The first one being physical therapy, where the goal is to correct posture and strengthen abdominal muscles, although there is little evidence-based research that this is helpful. Next is medications such as aspirin, NSAIDs, or opiates, depending on the severity of the patient's pain. And this is not a long-term treatment, but it can provide relief for patients. And the next is epidural steroid injections. Again, not a long-term treatment, but it can provide short-term reduction of pain. And then moving over to the surgical, the most common type of surgical intervention is a laminectomy, which removes part of the lamina of the vertebra, and it makes more room for the spinal cord and nerves. Patients who have the most positive outcomes are those who are of male gender, younger, not obese, do not smoke, and who were able to walk prior to surgery. Next is a spinal fusion. This is typically done after a laminectomy, and it's where 2 vertebrae are permanently joined together by screws, rods, or hooks, and this stimulates new bone growth. So what are some teaching components? Number 1, make sure that the patient maintains physical activity because being inactive for too long can cause weakness and rigidity of the back muscles and ligaments. Light walking is appropriate. Number 2, if you begin to have loss of bowel or bladder, seek emergency medical services, again, because of cauda equina. Number 3, a nurse practitioner might order an MRI or an X-ray to visualize bone spurs or other changes associated with spinal stenosis. And number 4, physical therapy and medications are typically attempted first before moving to more invasive treatments such as surgeries. And these are my references. Thank you so much.